My name is Amr Azim. I'm a reproductive endocrinologist at New York City IVF. I want to talk to you today about selecting an egg donor. For some women, egg donation is a very viable option that enables them to become mothers. And one crucial step in this process is where are the eggs coming from and how do you select an appropriate donor. Egg donation means a young woman is stimulated and her eggs are retrieved. They are fertilized with donor sperm or partner sperm, and the embryos are then transferred back to the uterus of the mother after preparation of the lining. There are two categories of eggs that you can utilize. You can utilize eggs from a live donor, or you can obtain eggs, frozen eggs from an egg bank. These eggs were harvested in the past and then frozen and ready for distribution. Live donors could be known or anonymous. An example of a known donor would be a sister donor. A younger sister would donate to her older sister, would be an example of a known donor. Anonymous donor would be a third party, usually a physician or an agency will find a donor, give the mother information about the donor, but the mother does not meet the donor, and the donor is also stimulated, and the eggs are then after fertilization are transferred anonymously to the mother, and there will be no connection between the intended parents and the mother. If a live donor is used, the precautions for selection is that they would have to undergo extensive psychological evaluation. They have to understand the process and be responsible individuals that will complete that process. They should have a very good number of eggs in the ovary. Their age should be less than 32, preferably less than 28, and so that they would have a very high likelihood of producing a big number of eggs. They should be tested for genetic diseases, especially the most common genetic diseases and genetic diseases in their ethnicity. They also should be tested for infectious diseases like hepatitis B and C and HIV and syphilis initially, and then the tests are repeated within a month of utilization of the eggs in specialized labs approved by the Food and Drug Administration. All of that to minimize or hopefully to avoid the transmission of any genetic problem or an infectious disease problem to the mother or the baby. There are other aspects in selection related to facial features, educational level, and so on. When a known donor is utilized, usually sometimes emotional aspects are involved, and that could actually make anonymous donors more successful than known donors. However, it's a viable option. Selecting a donor from a bank means you are going to use the available eggs in that bank, and which minimize the somewhat the broadness of selection, meaning you will use the eggs that are available for immediate distribution. And the other point here is it is not proven beyond doubt that frozen eggs have the same success in producing a baby as fresh eggs, because the eggs are distributed from the bank in the form of frozen eggs. However, using an egg bank markedly minimizes the wait time to find the right donor and to stimulate the right donor when she's available. So this is a plus for egg banks. However, your choice is restricted and you will be using frozen eggs rather than fresh eggs. Thank you.